Commonly, back pain can come from the muscles along the spine. In fact, there's several layers of muscles, some of which are several inches deep, and it's possible to get trigger points and knots in those muscles which can be the source of the pain. Alternatively, the pain may be coming from deeper than that. It may be coming from what's known as the facet joints, which are knuckle-sized joints, one at each level of the spine, at each vertebral level, one on the left, one on the right, and those joints can either become jammed or stuck. They may become inflamed, they may become arthritic. Another common cause for back pain is wear and tear within the discs of the spine. So if those discs are wearing out and becoming thinner, then the vertebral bones are more approximated, and that can lead to pain, swelling, inflammation in those tissues, and may also cause trapped nerves in the spine, giving sciatica down the leg and back pain related disorders. Also, it's possible to get pain coming from the ligaments. So ligaments will be the kind of fibrous bands of tissue which hold one or help support one vertebral level connected to another. And again, injuries, bad falls, bad twists, with that you can strain those ligaments as well, and sometimes that again can be the source of the pain. So each of these conditions and each of these tissues can give you some pain, and the treatment for those would need to be, in my opinion, tailored according to where the pain source was, which of those tissues was the actual one that's giving you the pain. We offer standard osteopathy, which involves precise stretching, deep massage, and in some cases manipulation of the spine. Also, all our osteopaths are trained in a special type of acupuncture called trigger point dry needling, which is really good at releasing deep, stubborn, tight knots and muscles within the lower back and other areas. And for patients with degenerative or bulging discs in the spine, we have IDD therapy, which is an advanced form of treatment that uses precise computer-controlled traction forces to very precisely take the pressure off of damaged discs and pinched nerves in the spine. X-rays can be useful for looking at the bones in the spine. They will show obviously if there's any fractures there. They will help to look at alignment of the spine and posture. They can be done with the patient in various positions, so sitting, standing, bending, even if it's something we wanted to look at. But the downside with X-rays is that the patient does get a dose of radiation, which isn't always desirable. Plus, they do only show the bones, so they won't give any information on the discs, the ligaments, the muscles, the nerves. There's a lot of stuff you don't see on the X-ray. So to be honest, we don't routinely send patients for X-rays at the clinic unless we really think there's a need for the X-ray. If there was an investigation that we want to do with the patient to get more information of what's going on inside, then really it tends to be an MRI scan, because the MRI scans, you'll get a lot more information. You'll see everything. You'll see the discs, the muscles, the ligaments, the nerves, all the tissues that you're interested in, all the tissues that could have damage and could be the source of potential pain. With the exception of IDD therapy, which can take sometimes a little bit longer, we'll generally know, especially if it's a manual kind of hands-on session, we'll probably know within about 3 or 4 treatments whether or not we're making a difference to that patient, and usually by then the patient should be feeling a lot better. If that's not the case, then we'll have to revise the treatment plan and try and do something different, or it may be a case of us referring them and putting them in touch with somebody else who can help them, such as a surgeon or a pain doctor who may need to deliver an injection, something like that. But we're very conscious we don't like to waste patients' time or money. And a classic example is a chap I saw the other day who had been to another clinic, had been treated 6 times and hadn't got any benefit. Really, we saw that patient, we thought, right, this chap needs an MRI scan because there's something going on. As soon as we got that MRI scan, there was a feature on the MRI scan which essentially meant that really we weren't the people that he needed to see, and he needed to see a surgeon. He had a particular condition where part of the disc was breaking away from the main body of the disc. We saw that on the MRI scan, and straight away we're very frank and very honest with that patient that he needed to go and have surgery. Thankfully, that particular case was very unusual. Most patients don't need to go and have surgery for the back pain. I think any spinal surgeon would be the first to tell you that. And a good 80–90% of people, even with chronic back pain, can get a good outcome from having some manual therapy. For me, the number one thing would be to keep the natural curve in the lower back. So the lower back should have a slight, gentle inward curve to it, and that really, especially if you're lifting things and if you're sitting for long periods, you need to keep that slight curve. Without that, you're going to be ending up straining the discs most likely in the spine. So also on that point, I would say be very careful of slumpy sofas because they tend to make you slouch. So to be honest, whenever I sit in a sofa, I've always got a cushion behind my back to help to keep that back supported. After that, I would say routinely do core stability exercises because they're a good way of helping to support the spine if your core muscles are nicely tuned up. People who suffer back pain will often get a reflex deconditioning of those muscles. So you may not be aware of it, but you get the back pain gets better, but those muscles have been left a little bit more deactivated and a bit more vulnerable to future injury. So do core exercises. And probably the third one is don't suffer in silence. There's lots that can be done. If you do have back pain, come and see us. So this is a really common question that I get asked in clinic. What I would say is that both are good. I think doing something rather than doing nothing is a good idea. But what we're starting to see now is that, especially with the work being done by the likes of Stuart McGill in Canada, what we're seeing is that rigidity and core stability is the way to go over too much flexibility. The most clear example I've had of that in clinic is when I was working at our Harley Street clinic and I saw a chap in clinic who had got lots of problems in his spine. We scanned him and he had what's called a protected L5, meaning that his last disc in the spine was very low lying in his pelvis. And it meant that it's protected and there was very little movement that went through that particular segment. And what we saw in the scan was that that particular disc was extremely healthy. It was very hydrated, it hadn't lost any disc height. It was all the levels above, and where he'd been exercising, all the strain had been going through those, all the levels above in his lower back were quite severely degenerated. So he had tears in his disc, he had bulges in his disc, but that last one was preserved. So what I would say therefore is that my advice is to steer out the two, steer in the direction of the Pilates. I think it's also important though to try and go, if you can, for the modern forms of Pilates, which will emphasise keeping that neutral curve in your spine. The other thing to say as well is that you do want to have flexibility in other parts of the body, so the hamstring muscles, other leg muscles, glute muscles, quad muscles need to be quite flexible. But if you're doing those sorts of stretches, again, I would prefer people to do that whilst they're preserving that natural curve in the lower back. Sometimes what can happen is if they're just doing bending down, touching their toes, a lot of the movement actually goes through the spine and they're bending their spine, thinking they're stretching the hamstrings when actually they're putting pressure on the discs rather than keeping the hamstrings flexible.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.